Male circumcision, the surgical removal of the foreskin covering the tip of the penis, has been practiced for centuries across various cultures and religions. Circumcision is a common procedure for many newborn boys, and it is a topic of ongoing debate. Should you choose it for your son? While some families opt for circumcision for medical, cultural, or religious reasons, others decide against it. The decision is deeply personal, and understanding the benefits and risks can help you feel confident in your choice. Newborn circumcision is often performed within the first few days of life, usually on the second or the third day after birth or shortly after discharge. Making your decision before delivery can save you from the added stress during those first exciting but exhausting days. Discuss the pros and cons with your pediatrician and your partner ahead of time to ensure you are on the same page. Note that circumcision is not universally recommended for all newborn boys. However, there are several reasons families choose to proceed with it. Studies show that circumcised boys have a slightly reduced risk of urinary tract infections or UTIs. Overall, UTIs are rare in males but can lead to serious complications if untreated. Circumcision makes genital hygiene easier by eliminating the need to clean under the foreskin. Circumcision may lower the likelihood of developing sexually transmitted infections like HIV and HPV related cervical cancer in female partners. The World Health Organization recommends voluntary male circumcision as part of HIV prevention strategies in high risk areas. Phimosis, a condition where the foreskin becomes too tight to retract, can lead to pain, infections, and difficulty urinating. Circumcision eliminates this risk entirely. Though penile cancer is extremely rare, studies suggest that circumcision provides some protection. In certain communities, circumcision is valued for cultural traditions or religious beliefs, the procedure representing a meaningful tradition and rite of passage. As for the procedure, it is quick and typically safe. When performed by an experienced physician, circumcision is a quick procedure, often taking just a few minutes. Local anesthesia is typically used to minimize discomfort. Important considerations to note are that while circumcision is generally safe for healthy newborns, it is not appropriate for every baby. For instance, babies born prematurely or with an illness at birth should not undergo circumcision immediately. Infants with blood clotting disorders or born with certain physical defects like hypospadias may not be good candidates for the procedure. Although circumcision has benefits, it also comes with potential risks like any surgical procedure. Infection or bleeding are the main complications, though uncommon. Pain or discomfort during the healing process is another risk. Even though local anesthesia is typically used, infants may still experience pain during and after the procedure that can last for several days. Poor cosmetic outcome is another problem, and there are rare cases of more severe issues such as injury to the genitals. Other downsides about circumcision include ethical considerations. Circumcision is often performed during infancy, a time when the child cannot provide informed consent. Critics argue that it is an irreversible decision that should be left to the individual when they are old enough to decide for themselves. Some believe that removal of the foreskin reduces penile sensitivity, potentially affecting sexual pleasure later in life. However, the evidence regarding this issue is inconclusive and varies between individuals. Also, many contrarians argue that circumcision is not medically necessary for most males, particularly in developed regions where hygiene practices are adequate with proper education about cleaning the foreskin. Choosing whether to circumcise your son is a significant decision. It remains a personal and sometimes controversial decision, but there is no one size fits all answer. While it offers specific health benefits, it also comes with risks and ethical considerations. Take the time to research, reflect, and discuss your options with your pediatrician to make an informed choice based on medical evidence, cultural beliefs, and personal preferences. The most important thing is that you make the decision that feels right for your family. Thank you very much for watching.